Locally, we are seeing hospitals with zero ICU availability tonight. These are all the counties in our area that have at least one hospital where no beds are available. And if availability continues to decrease, we could run into some big problems. Tampa Bay's Madison Allworth spoke to doctors about our current status and what's to come if beds don't free up.
It'll be a tightrope over the next few weeks, and I know the healthcare systems are watching that very closely.
As ICU beds fill up, doctors warn that our situation could very well get worse.
I think it's going to continue to be a problem. Now that it's becoming more clear that the UK variant is not only in Florida, but it seems to be more transmissible as well.
Dr. Teng also thinks the recent holidays could be an issue.
Especially with all the kind of maskless gatherings that we've seen over the holidays. That's going to translate into a spike in cases in the next week or so, I think.
If things get really bad.
Well, when you get to 100%, right, that's it. So then you start having to do these makeshift things that people are doing, trying to put patients into any available space.
So far, we've been all right, but it's not just the actual space we need to worry about. There need to be enough healthcare workers to cover a growing sick population.
And that's really the biggest issue facing the hospital systems, is that if we continue to see these surges on surges, we could get to the point where, despite having actual beds, we don't have enough personnel to staff those beds.
That's why it's also essential to keep healthcare workers healthy.
I think the idea that we're vaccinating our frontline workers is important, because you can always try to find a way to put a bed in, but you can't find new trained personnel quickly.
What do people in Tampa Bay need to be doing so that we don't run into a problem where we're running out of space in our hospitals?
Really, vaccines and masks and physical distancing, these are our tools right now, and we really need to utilize them.
As eligible healthcare workers get their second dose of the Pfizer COVID-19 vaccine, that will help with safety efforts. But we are still a ways away from all hospital staff being immunized. As of today, the Department of Health is reporting 255,808 people across the state have been given a first dose of the COVID-19 vaccine. 50,729 of those doses have been distributed here in our area.